Ever wondered why pain is such a common experience, or how countless individuals manage it? One particularly popular method is through the use of topical ointments. These ointments are as simple as they are potentially effective. Today we'll delve into the science behind these ointments and how they work to relieve pain. Topical ointments are applied directly onto the skin and work by being absorbed into the body. They often contain active ingredients such as analgesics or anti-inflammatory substances. Once applied, these substances penetrate the skin, acting on a local level to block pain or inflammation pathways. One of the main benefits of topical ointments is their ability to provide targeted pain relief. Unlike oral medications that must circulate throughout the entire body, topicals work directly at the source of pain. This direct approach potentially reduces the risk of systemic side effects. Many topical ointments for pain relief contain capsaicin, a compound sourced from chili peppers. Capsaicin works by decreasing a neurotransmitter known as substance P, which plays a role in transmitting pain signals to the brain. Studies have found that capsaicin ointments can effectively reduce pain caused by conditions such as osteoarthritis and neuropathy. Another common ingredient in topical pain relievers is menthol. Menthol creates a cooling sensation on the skin, which can lessen pain by temporarily desensitizing pain receptors. Ointments with menthol are often used on aching muscles and joints. Some topical ointments contain non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen and diclofenac. These ointments work by reducing localized inflammation, which can be beneficial for conditions like tendinitis or bursitis. Topical ointments can be useful in treating a variety of conditions. For instance, those with arthritis-related pain and inflammation may find relief with NSAID or capsaicin-based ointments. Athletes and individuals with muscle and joint discomfort often turn to menthol-based ointments. Even neuropathic pain, often associated with conditions like diabetic neuropathy, may be managed with topical capsaicin ointments. However, it's important to remember that everyone's reaction to topical ointments can vary. What works best for one type of pain may not be as effective for another, so some trial and error may be necessary. While generally considered safe, topical ointments can sometimes cause skin irritation, redness, or a burning sensation. In summary, topical ointments offer a targeted and potentially effective method for pain management. They work by delivering active ingredients directly to the source of pain, providing relief from various conditions. Remember, individual reactions can vary, and it's important to find the ointment that works best for you. Always use them with care, and consult with a healthcare provider if you have any concerns.